When it comes to our health, what you don't know can hurt you. Some of the most dangerous diseases are also the most deceptive, lurking silently in our bodies for years without any clear signs. By the time they're discovered, it's often too late for effective treatment. These are the silent killers, and understanding them is the first step toward protecting yourself. Today, we're uncovering 7 dangerous diseases that are often detected far too late. First on our list is high blood pressure, also known as hypertension. It's a classic silent threat. You might feel perfectly fine while inside your body, the force of blood against your artery walls is dangerously high. This relentless pressure can go unnoticed for years, quietly damaging your heart, arteries, kidneys, and brain. The first sign for many is a catastrophic event like a heart attack or a stroke. This is why regular blood pressure checks are not just a routine, but a potentially life-saving necessity. Next, we have diabetes. While many are aware of its existence, few realize how stealthily it can develop, particularly type 2. Your body might be struggling to use insulin effectively, causing sugar to build up in your bloodstream, but the early signs like increased thirst or frequent urination are often so mild they're easily dismissed. Over time, this high sugar level can inflict serious damage on nerves, blood vessels, and organs, leading to complications like blurred vision, kidney failure, or nerve damage before a formal diagnosis is ever made. Pancreatic cancer is notoriously difficult to detect in its early stages. The pancreas is located deep inside the abdomen, making it hard to see or feel tumors. The initial symptoms, such as back pain, unexplained weight loss, or mild indigestion, are vague and often mistaken for less serious conditions. Because of this, a staggering 80% of patients are diagnosed at an advanced stage when the cancer has already spread, making it one of the deadliest forms of the disease. For women, ovarian cancer is a particularly insidious foe. Its symptoms, including bloating, pelvic discomfort, and changes in appetite, are common and frequently attributed to digestive issues or normal menstrual cycles. There is no simple and reliable screening test for ovarian cancer, unlike a pap smear for cervical cancer. This diagnostic challenge means it often progresses to an advanced stage before being correctly identified, drastically reducing survival rates and highlighting the critical importance of women advocating for their health when something feels persistently wrong. Chronic kidney disease is another silent progressive illness. Your kidneys are incredibly resilient, able to function even when they've lost a significant amount of their capacity. As a result, you might not notice anything is amiss until the damage is severe. Symptoms like fatigue, swelling in the ankles, and changes in urination usually appear only after your kidney function has dropped to a critical level, sometimes requiring dialysis or a transplant. By then, the damage is irreversible. We also have fatty liver disease, which is becoming increasingly common. This condition involves the buildup of excess fat in the liver and often has no symptoms at all. It can be caused by excessive alcohol use or, more commonly, by a non-alcoholic variant linked to obesity and diet. Left unchecked, this fat accumulation can lead to inflammation, scarring, cirrhosis, and eventually, liver failure. The liver works silently until it can no longer cope with the damage. Finally, there's osteoporosis, a disease that literally means porous bones. It causes bones to become weak and brittle, but this process is completely painless and invisible. Most people have no idea they have it until a minor bump or a sudden fall results in a debilitating fracture. By the time a broken hip or wrist reveals the underlying condition, significant bone loss has already occurred, making prevention and early screening through bone density scans crucial, especially for older adults. These silent diseases underscore a vital truth. Waiting for symptoms to appear is not a reliable health strategy. The best defense is a proactive offense. Regular medical checkups, understanding your personal risk factors, and listening closely to even the most subtle changes in your body can make all the difference. Your health is your greatest asset. Don't wait for a warning that might come too late. If you have any concerns, no matter how small they seem, make an appointment to see your doctor.